Hi, this is Bridget Harley from the Hearing Clinic. Today we're going to be talking about some of the important skills we need to navigate our complex auditory world. The first two skills we are going to be talking about is lateralization and localization of sound. Lateralization is the skill we need to know whether a sound is coming from our right side or our left side. Localization is our ability to pinpoint where a sound is in our environment. That sound may be in front of us, behind us, slightly to the right, slightly to the left, or even above us. Right, so how does localization work? Well, the reason we have our two ears stuck on the side of our head rather than having two ears in the middle of our head is so that they are maximally separated from one another. This means that if a sound arrives from this side, it will arrive slightly sooner at this ear than this ear. Equally, the sound will be ever so slightly louder at this ear than this ear. These tiny interaural level and timing differences are then fed into the brain, and the brain will make use of these tiny little cues to help us know where a sound is coming from. Now, this system works very well if both eardrums are functioning nicely and there's good hearing in both ears. However, if we see a situation where a child or adult has a glue ear or some hearing loss in one ear, then this system will not work so well. Glue ear is when we see a buildup of thick, sticky fluids behind the eardrums. If you imagine a sound is arriving from this side and this ear has glue ear, the sound may then start to drag or lag through the thicky fluids. If this ear is clear, then that ear may be able to process the sound well. However, unfortunately, these small interaural level and timing differences are not preserved. This means that the brain is unable to use these cues to help us know where a sound is coming from. The impact of this can mean that a child will struggle to follow the teacher's voice in the classroom, or on the sports field may struggle to hear where the other players are. Crossing roads can be tricky because it may be difficult to determine the direction of the oncoming traffic. So it's really important that we have good hearing and clear middle ears to develop good localization and lateralization skills. If a child has recurrent ear infections or long periods of glue ear in their early childhood, then this may sometimes impact the development of good localization skills. Thank you for listening.